Hi, my name is Greg Portland. I'm a board-certified orthopedic surgeon who specializes in sports medicine. My specialty is in taking care of shoulder and knee conditions, especially for athletes. So the shoulder is a complicated joint consisting of a ball and socket joint. So the muscles that power our shoulder is called the rotator cuff. Inside our shoulder, we have a collection of a bumper made of fibrous tissue as well as ligaments that hold the shoulder in place, and that is what is known as the labrum. Unfortunately, triathletes can sustain injuries to their labrum. For repetitive overuse that is necessary for their training in pool and open water, the labrum often can tear, and this can either give them pain or a feeling of looseness. Fortunately for most, they don't have any symptoms at all, and they can swim just fine even with a labral tear. Unfortunately for some other triathletes, they either can have pain with reaching, rotating, and especially sleeping. They usually can get better with a dedicated physical therapy program. By improving the biomechanics of the shoulder, symptoms from the labral tear often will go away where they don't need any other treatment. Steroid injections, which a lot of people wonder about, aren't as effective for labral tears as much as they are for rotator cuff issues. A small percentage of people who continue to have pain with sleeping, pain with activity, or a feeling of instability, unfortunately may require surgery. Unfortunately for the small percentage of patients who need surgery for a torn labrum, surgery can be quite helpful in eliminating their pain. If an athlete does not have any arthritis, the chance of them getting back to competitive swimming approaches 90%. Unfortunately, it takes a while for the labrum to heal. So at the time of surgery, the labrum is refastened to the socket, and that process biologically takes time. It requires an athlete to be in a sling for 5 weeks, followed by physical therapy. At the beginning of the 5th month, patients can start doing breaststroke and light weightlifting, and overhead swimming, crawl, and heavy weights is held off for a full 6 months. Most athletes would say it takes 9 to 12 months before their shoulder feels normal again. My recommendation to people who are triathletes is to see a dedicated physical therapist who does a lot of overhead training to learn about the biomechanics of the shoulder, and especially focusing on shoulder blade strength. If our shoulder blades fatigue, it changes the mechanics of our shoulder, where people's mechanics can lead to the development either of a labral tear or rotator cuff tear. The best treatment always is in prevention.